I don't pull anybody.
Forms.
Okay, you guys ready? All right, so these are the things
The things.
that you'll be responsible for. Okay, ready? So here we got the external anatomy that you're gonna have to know. So this is the apex, this is the base, this is the interventricular sulcus right here, and so this is a coronary artery. Okay, that supplies blood to the actual muscle of the heart. The external part, the smooth outside, that's the epicardium, or the visceral pericardium, and then this is the myocardium, and then the endocardium. Our chambers. So the big chamber is the left ventricle. The little chamber is the right ventricle. I feel so famous. Paparazzi. Okay, and then the two smaller chambers that are superior to these, those are your atria. So right and left. Okay, so let's talk about blood flow, and we'll name the parts as we move through the heart. Okay, so blood always enters the atrium first. So this is the right side, and this gets blood returning from the body. So it's low oxygen blood. And this is going to enter into the right atrium. So that makes this your superior and inferior vena cava. Superior and inferior vena cava drain into the right atrium. The right atrium contracts, and we'll go over electrical conductance in a second. And when it does that, it pushes open the tricuspid valve. Tricuspid valve opens and blood goes into the right ventricle. Okay? This stringy substance here, this is trabeculae carne, and these strings that are onto the valves, those are chordae tendineae. Okay? These strings onto the valves are chordae tendineae. Heartstrings, correct. And the chordae tendineae attach, you can see this big lump of muscle, and that's called a papillary muscle. There are other muscles in here. They look like grooves, like little hills and valleys, and those are pectinate muscles. Okay, so we got right atrium contracts. We've got tricuspid valve opens. We've got blood entering the right ventricle. Now the right ventricle is going to contract, and when it does that, it's going to push blood out through this tube. Okay, so this is going to go to the lungs. So we've got, this is the pulmonary artery because it's going away. So from right ventricle, as far as the right side, we've got right atrium, we've got tricuspid valve, we've got right ventricle, and then we've got pulmonary artery. That's right, pulmonary artery. Okay, now right inside here you'll see, there's a valve right here.
Oh,
there it is. So that is your pulmonary semilunar valve. Okay, and that makes sure that it's one-way flow. So now the blood's going to the lungs, it gets nice and oxygenated, and it's going to come back. And it's going to come back into the left side. Okay, so the left side here, so this big hole right there, it's going to enter into that, and this is the pulmonary vein. Pulmonary vein is going to enter into the left atrium, and then the left atrium, when it contracts, it's going to push open the bicuspid valve, right here. Chordae tendineae on papillary muscles, trabeculae carne, and pectinate muscles. Okay, when this contracts, it's going to push open this valve. This is the aortic semilunar valve. Here, it's dissected so you can see half on each side, and then that's going to push blood up through the aorta. Okay? And that supplies the blood to the body, oxygenated blood to the body. Let's go over the electrical conductance real quick here. So we want to be on the right side. So on the right side, the smaller side, it's getting the deoxygenated blood. At the very top of the right atrium, inside there is anybody know? The pacemaker? Yep, the sinoatrial node, and that's the pacemaker. So that's going to cause a signal to be produced and actually potentially be generated, which is going to move over the superior part of the heart, okay, the atria. That's going to cause them to contract. That signal is going to converge right about at the top of the interventricular septum, which is this. Okay, and that point right there, that is called what's that node?
AV.
That's the AV node, atrioventricular, right? Because between the atrium and the
Wait, so
ventricle.
SA, sinoatrial?
Yes. Uh-huh.
What is it?
Atrial. Yep. And then this is the
Atrioventricular.
atrioventricular, right? And so this, it takes that action potential and it holds it for a second, okay, making sure that all of the atrial blood is emptied into the ventricles. And then it's going to move down. It's going to move down in a bundle called the HIS bundle or the AV bundle, atrioventricular bundle, which is going to go into right and left sides, down to the bottom, down to the apex, and then it's going to rise up the walls of the ventricles as Purkinje fibers, right? And that's going to cause the ventricles then to contract. Okay, so that's anatomy that you have to know, and blood flow, and electrical conductance. Okay, got it?